Welcome to another edition of Dan Frequently Asked Questions. In this edition, we'll be discussing iron levels and diving. Keep watching. We got a question from a diver asking whether we had any information about individuals diving with low iron levels or have undergone intravenous iron infusions. Good question. Dan doesn't have specific guidelines on anemia or iron deficiency in diving because low iron mainly has that as a consequence. It lowers your blood oxygen carrying capacity by limiting the number of red blood cells that you have. And so this can theoretically increase the risk of hypoxia, especially during strenuous dives. However, underwater, the partial pressure of oxygen is elevated, so the chance of this happening is actually fairly remote. But if your iron levels are low, and particularly if this is not just the result of low iron, but because of a disease of hemoglobin, like thalassemia or sickle cell disease, there are other considerations. But for pure iron deficiency, it's obviously best to have that treated, and certainly if you get exhausted easily on land and also lightheaded, because a lot of exercise is performed at the surface. So, if you've recently had iron treatment or intravenous iron therapy, you'll want to be sure that you're fully recovered from any potential side effects like dizziness, nausea, blood pressure changes, and so on before diving. And checking your hemoglobin before returning to diving is always a good precaution. If it's within normal limits and you feel okay, you should be good to go. Thank you for the question. Thank you for asking it on Dan Frequently Asked Questions, and until next time, safe diving.